So we have this patient case that we published this summer initiated by an investigator that saw remarkable improvement in the first patient that clinic had treated with our drug CS1 for 12 weeks. And the patient was moved from functional class 2 to functional class 1, which means that rather than being very disabilitated with the diagnosis and the disease, not really feeling the impact of the disease. And that's a remarkable improvement on top of standard therapy. So our study's primary objective is safety and tolerance, phase 2A. But we call it phase 2AB because we have implanted a lot of efficacy measurements in this study, including the amazing technology CardioMEMS that we do in collaboration with Abbott. So with this technology we can measure efficacy parameters, not only pulmonary pressure impact of our drug, but other cardiac functions. And in this patient case, we lowered the blood pressure with 30% and we improved cardiac output with 20%. So almost normalized blood pressure in the pulmonary arteries and almost normalized cardiac flow. And this is possibly the reason why this patient was so improved. We are initiating now a data control initiative in this study where we will look at the patients that are on drug now, 16 of a total of 30, that's the objective. But we will start to study the adherence to protocol, the adherence in data transfer on CardioMEMS, and if needed, correct that so we optimize our ability to have conclusive data by the end of the study in Q1 next year. We will also, by doing so, be able to get an opinion on if there is some clinical efficacy that's relevant in these first patients in the study, which will be somewhere between 35 and 50% of the patient's material. So this is a very exciting time for us and it's triggered by this patient case, but we will now be looking at about half the patient material by Q4, so just in a few weeks from now.